Premature rupture of membranes was taken from chapter 21 of our book of obstetric and OBGYN. So, what is a preterm rupture of membranes? It's going to be defined as a rupture of the membranes before the onset of labor. Usually, this occurs before 37 weeks of gestation. If that happens, it's named preterm premature rupture of membranes. So we have here two concepts. Preterm rupture of membranes is just before labor, and preterm premature rupture of membrane, which means it's before 37 weeks. Risk factors for premature rupture of membranes, as I pointed out in our lectures, the main one is going to be infections. The infections usually is in the genital urinary system, but that doesn't mean that we can have infections in other systems, including dental infections or lung infections like a pneumonia. A premature rupture of membrane will conduct to a preterm birth of the baby. So if I have a history of PROM or preterm delivery, that's another risk factors. Also, when we have uterine distension with a lot of amount of liquid, amniotic liquid, polydermuse, or multiple gestation because of twins, cervical incompetence, trauma, and cigarette smoking are also risk factors. Remember that the risk factors have to do with the degradations of the membranes components. The main component of the membranes are collagen, and there are other also components. So, what are the causes? So, we have a lot of causes. So, we can have a physiological weakening of the membranes. We can have an infection. We already talked about that. We can have also an accumulation of one or two or several risk factors, history of previous PROM, short cervical length, second or third vaginal bleeding, uterine overdistension, a lack of vitamin C or any other nutritional deficiency, problems with the collagen, low body mass index, low socioeconomic status, smoking, and illicit drugs. That's cocaine. So this table is pointing out if we have a term premature rupture of membrane that is going to occur after 37 weeks, and usually the frequency is it's around 8% of the pregnancies. Usually preterm premature rupture of membrane occurs between 24 and 36 weeks, and overall 3% of the pregnancies. But if we take into account the preterm pregnancies, the preterm babies, it's going to be around 30%. And then we have a pre-viable premature rupture of membrane that occurs before 24 weeks, and that is less than 1% pregnancies. So what's the pathophysiology? We talked about this. Pathophysiology, to understand, is to look what are the components of the membranes. We have collagen, we have laminin, we have fibronectin. So any imbalance between the matrix metaproteases and the matrix metalloprotease inhibitors are going to interact and degrade the collagen. Also, the inhibitors of the protease are maintaining the integrity of those membranes. So the disbalance or imbalance between the uh, protease that degrades and the factors that inhibit the degradation is one of the pathophysiology or underlying pathogenesis that's occurring. The other thing is any event that potentially may disrupt those membrane, like the infection, inflammation, mechanical stress, or bleeding, are also part of the etiology plus the pathophysiology mechanism. So just to review, I'm pointing out here an example of what occurs during the pathology of an infection and maybe an hemorrhage, right? So we have bacterial vaginosis, part of the sexual transmitted disease, is a risk factor for preterm labor. And this person that has a bacteria vaginosis, it's going to have an ascending infection, usually caused by several pathogens of the group B, Streptococcus, uh, or it could be a Mycoplasma, or it could be Ureaplasma ureolyticum. So this bacteria, it's going to elicit an immune response with the elevation of interleukin 1 beta. Interleukin is one of the most useful immunological biomarker that could be used to diagnose treatable discharge that cause sexual transmitted disease or bacterial vaginosis, for example. So what happens here is that the presence of the infection will not only raise interleukin beta, also it will raise interleukin 6, TNF alpha, interleukin 8, and it will produce an immune system response. The next thing that happens is TNF alpha, for example, is a good stimulus for the production of prostaglandins. And prostaglandins, when prostaglandins are present, they can activate the contractions of with other with other factors, the contractions of the myocytes in the uterus, and contractions will start and premature uh, preterm labor will start if the patient is less than 37 weeks.